It is just a huge, huge honor for me today to be podcast interviewing Dr. Christian Stanfield from right up the street in Glendale, Arizona. He's a dentist, entrepreneur, and the founder of Elevate Dental Consulting, where he helps dentists turn their practices into high-profit, low-stress businesses that actually support their lives. After graduating in 2020, Dr. Stanfield went all in, buying and merging 3 practices, soon to be 4, into one thriving location into Glendale General Dentistry, right in one of Arizona's most saturated markets. That bold move helped him hit 7-figure profitability while cutting stress and building a model that dentists can't replicate in any market. Today, he's on a mission to teach practice owners how to build wealth, reclaim their time, and fall back in love with dentistry through smarter systems, leadership, and strategy, not just more chair time. And I before I let you talk, I just want to tell my homies one thing on why I'm so excited to get you in here. And that is, I've seen more. I got my MBA from ASU. I didn't get a fake one from like U of A or something. I mean, I got the real one. And U of A, you just got to drive by the school real slow with your windows down. They'll throw a diploma in your back seat. But basically, in the business world, when you get in your B school, all the Fortune 500, all they do is M&A activity. Then you come into dentistry, they don't even know what it means, and it's non-existent. And then over the years, I watched, trying to, on podcasts and read a lot of them, like, who are these big boys running $5, $6, $7 million offices? And what it was is say a small town, say it's 5,000 people, and the draw is twice the town population. So the 5,000 town, it's got another 5,000 that are driving up to an hour into there. And if you need a dentist for 2,000 people, 5,000 town with 5 dentists, that's perfect demographic. You should have got your demographics done. But instead of going to that small town and opening up a new office, so now there's 6, they would go in there and they'd work for they'd go in for the oldest man, and they knew this all ahead of time in their mind what they were doing. Mm-hmm. They work for the old guy, and then they buy him out. So now they own that practice, and there's still just 5 guys. And then he's whining and dining and courting and relationship, and he's always got his eyes on who's the oldest next dog to retire. Mm-hmm. And over the course of 10, 15 years, he bought all the retiring doctors in town, and he's sitting in this town, 5,000 people, where everybody flies over, drives by, thinks there's no money in that town. And this guy's sitting there. And by the way, when those doctors retire, they always say, "Oh yeah, I'm going to retire at 65." Yeah. Well, if you're married and your wife says, "Well, can we, the house that we completely redecorated, I need to redo the front room, and I need a new car." And so that retirement can drift for years, and they might say, "Well, I'm just going to do 2 days a week." 2 years later, they're doing 1 day a week. And then something happens in their personal life, a kid falls down or whatever, and they go back to 2 days, sometimes 3 days. Mm-hmm. But the bottom line is they basically work until they, at least one guy told me that the lowest dentist he had working for him that retired comes in 2 days a week from 6 to 10. That's still 8 hours. That's still 8 hours. So they got all those relationships. They know everybody. And that's what you're doing. Is this your original idea? Did you learn in B school? I mean, where did you get this amazing idea and skill set?
No, it kind of fell in my lap. So we had a temp hygienist who was coming into our office while we were just trying to hire someone permanently. And she came to me because the office that she'd been working at for 25 years was closing. They were selling the building to a pediatric dentist, and they didn't have anyone that was going to buy the patient charts. So she had been seeing patients for 25 years, and she knew all of them, first name, last name, goes to the bar and plays trivia with them on Wednesday nights. Like, she knows all these people, and she'd have a dentist to take them to. And so she had enjoyed her experience temping with me, and she said, "Hey, you need to reach out to these people and see if you can buy these charts." So I was like, "Okay, well, I'll see what we can do." And by the time I reached out, like, they were closing on this building like the next week. So it was the final hour. They, this is what they were doing. And so I kind of came in and knew that I had all the cards. And so I just kind of offered, like, I'll pay you this much money up front. $7,500 is what it was. And that's going to go towards the first 100 patients. Every patient after that, I'll pay you a specific amount of money, $250. And that's pretty low per patient for any type of, what you'd spend for a marketing lead or to actually get a new patient in your office. That's very low, right? So I was feeling pretty good about that. We only tracked it up to 6 months, and we didn't get up to 100 within the 6 months. So I ended up paying these people $7,500 for all their patient charts. All of these patients came because they love their hygienist that they've seen for 25 years, every single one of them. The hygienist knew me and trusted me. And in a lot of these older practices, the dentists, they stop being dentists and they're just watchodontists, and they don't really diagnose a whole lot. So there's a lot going on with these patients. And so these new patients would come in, we diagnose quite a bit, and the hygienist who I had built rapport with would encourage them, hey, you should go ahead and get this stuff taken care of. And I just checked reports this year. I've had it since 2 years since I closed on it, and we've done $500,000 in revenue in 2 years from these specific patients that I spent $7,500 on.
Man, I need to tattoo genius on the top of your forehead. And I mean, that's killer. And the other thing is, those temp hygienists are just amazing. Every time I ever had a temporary dental assistant or a temporary hygienist, I'd always say to her, look, man, we all, I was team meeting, and I'd say, look, we all live in one building and we all drink the purple Kool-Aid. And then this girl is in, 5 different offices a week, maybe 10, 20 a month for years and years and years and years and years. So I want to tell you that this is the God of the day. And I don't care how we do it. I don't care how we do it. I want you to listen to this girl, and she's seen something better in everything we do. Some office is doing it better. And I was talking to a temporary hygienist today. Actually, she was cleaning my teeth at where I go. They had a temp, and it was just amazing. I was talking to her, and she, just like you said, she goes, Howard, those old dentists, they don't even probe. She goes, I said, are you telling me she goes, there's dentists within a mile of your office. I mean, she said, no, she's been doing this for years. She goes, great people, great guys, but they're old. And so then if you knew that temporary hygienist, you say, well, who, the first thing I thought is, my God, you should be courting all the temporary hygienists out there saying, man, when you're in an old office and, something's going down and this guy's sick and he's old and whatever, but it just blows my mind. People just don't understand the distribution of skill sets among dentists. And I remember when I was in dental school, there was a funeral I had to go to back in Parsons, Kansas, in the family. And I was there, and Grandma told me, she goes, that guy over there is a dentist. So she wanted to introduce me to him. And she goes, my grandson, he's in dental school. And we were talking, and I said, I said, so you see a lot of gum disease? He goes, I think it's the water, because I've never seen gum disease in Parsons, Kansas. And I'm like, and I was so young and dumb, I thought that I just discovered something, like fluoride in the water. I'm like, are you serious? I go back and I told Dr. Cobb, who's our periodontal instructor at KC, he just about died laughing. He was like, Howard, there ain't nothing in the water. That guy's just blind. So are you going to be looking for more, temporary hygienists to be scouting the Phoenix market for your M&A activity?
Yeah, I've asked that hygienist who now has been with me since then. She's on my staff now, but I ask her all the time because she still temps. She works. Our office is open 3 days a week, and so the other 2 days a week she goes out and temps. And we haven't found anything, her and I, through her since then. But I ask her periodically. I'm like, hey, you've been any practices, any slower practices, doctors slowing down, anything, people that I can reach out to, that kind of thing. So
yeah, and what's funny is you always hear, and I see right on the dental town where people hate temps because they don't come in, they do it their way.
Yeah,
it's like, buddy, you're looking at this completely ass backwards. You should be. I mean, talk about an in-office consultant. She's been in every office, because some of those in-office consultants, they come from 5 states over. It might work in Beverly Hills, it might work in New York City, but you're in Bumblebutt, freaking Arizona. You're in Glendale, Arizona.
Yeah.
Pardon me, but that ain't the That ain't the Beverly Hills of dentistry.
Yeah.
That's about as middle class as you can get. And so, when they're telling you what works in your own demography, this is what goes down. I mean, I almost think dental offices get temporary assistants and temporary hygienists just as consultants. Like, we're not even going to hire you to clean teeth today. Just come in here and tell us all the best practices that you've seen.
Yeah. Well, I had an assistant, temp assistant, a couple of weeks ago, and she works for an endodontist, and I kind of have the specialist that I like to send my patients to, but for endo, I think I'm still kind of between a few different offices and people that I prefer. But this girl who worked at one of those offices that I referred to, she's like, yeah, this specific doctor, this is who I work with. Like, hands down, this is the guy. Like, all of your patients need to come to this guy. No one's better than him, right? So even just that, like, she came in, she helped me out for a day. It was a little bit trickier because she used to do more endo procedures and the full spread of stuff that we do, but I was able to get really valuable info, and I now have an endodontist that I'm like, okay, cool. I
tell those young kids, I mean, just they got $500,000 student loans, and they want to learn something about TMJ. So they'll fly from here to Florida for a week and drop $5,000 and all this like that. I'm like, dude, you couldn't find that for free in your backyard. Don't refer to an endodontist unless they don't let you come by and assist you.
Yeah.
Don't refer to a periodontist unless you can't take study models and FMX there, and he sits down and goes over the whole treatment plan. Don't refer to an oral surgeon if he can't fax them the treatment plan, because you're going to wipe out that kid's $1,000 at Delta, and that's cool. But like, look, it's December 4th right now, right? So in January 1, he gets another 1,000, and I need another Dr. Alpha to say, hey, by the way, man, you're going to come here, and Dr. Farran wants these 4 wisdom teeth out, and that'll wipe out your insurance budget, but next month, January 1st, you get another 1,000. You got 4 fillings in there. Those are $250 a piece. And you don't go back there and get them filled, and those turn into root canals and crowns. Now it goes to $2,500 a piece, and that's 10,000. You don't have 10,000. You don't have 1,000.
Yeah.
And that's why at age 75, 1 in every 5 people don't have 1 tooth, and another 2 out of 5 are missing half their teeth. So you need to get back in there. And I had an oral surgeon where they always come back and say, yeah, the oral surgeon told me I needed to get right back here because so yeah, man. And then the best CE is always the textbook. Like, I remember when I went and took missions course, because when I got here, there were no dental schools, no floor in the water. And I was trying to get my FAG, my MAGD. And, so I had to fly to Pittsburgh, 7 3-day weekends. So obviously the first thing I do is read the book, and we both have 4 kids. Congratulations on that. And with 4 kids and a practice, it takes you a couple months to get through a textbook. I mean, it just does. I mean, you're busy. But I would read that and took the notes like, well, I'm not going to sign up for 7 3-day weekends unless I'm going to read the textbook first. And then you get there and there's just people the whole time asking questions that are in chapter 1, 2, and 3. It's like same thing with Dawson and the Pankin suit. Like it takes a long time to read Dawson's book. I mean, and by the time you get to that book, you're at a different level of TMJ, and you probably have to go sit down there, Panky, for 5, 6, 7 weeks to get the amount of time that you spent focusing on that one book. But hey, you got 3 websites. You got Elevate Dental Consulting, Elevate Dental Academy, and then you got, of course, your Glendale General Dentistry. Amazing. Like, let's just take the first one, Elevate. What's the difference between Elevate Dental Consulting and Elevate Dental Academy? And let's start with Elevate Dental Consulting, which I'm on right now. Yeah.
So the Academy is just the course that I have been working on over this past year.
That's the Academy.
Yeah. So just when someone sets up to do consulting, they'll get access to the course that they can then go through videos.
And how long is that course?
I mean, probably a couple hours of video. So it just at your own pace, going through different sections.
Is it just 2 hours?
Probably more than that. I actually haven't.
Because what you do, the best marketing in dentistry, the best free marketing in dentistry, say you got a 3-4 hour deal. you put the first hour on Dental Town, and it can
Oh,
be
yeah.
free if you want reach.
Yeah.
But if you know, like I remember like Jay Resnick when he put up 3 oral surgery courses, but they were free, and he didn't want
Draws
anything,
everybody
so
in.
they each got 10,000 views.
Oh, yeah.
And then someone else come along and put up a course, and they'll say, you know, great quality material on the same subject, but they'll want like, you know, $36 or $100, and now your course views drops in half or a third or whatever. But what is that Elevate Dental Academy? What's that breakdown? I see new patient marketing, maximize your existing patient base for growth and profitability, the impact of acquisitions on profitability, enhancing diagnostic accuracy with advanced tools, expanding your clinical suite, the importance of transparency in dental care, and case acceptance. I mean, my gosh, case acceptance is so important. I've always told people that 1 out of 3 humans are going to do what you say because you're a doctor. They've done an author search. I mean, when I went to my physician, he said, Howard, you're at the age now, you need to get a colonoscopy. Okay, well, that's what you do. I'm not going to argue with you. When the doctor says you're at the age you should get a colonoscopy, guess what you do? You go get the colonoscopy. 1 out of 3 aren't ever going to do it. They're going to go get a pack of cigarettes instead. They're not going to do anything you say. But that one in the middle is what you can convert. And the people who focus on case presentation, their practices are twice as big, because instead of 1 out of 3, they're getting 2 out of 3, and you're never going to get 3 out of 3. Yeah. So talk about some of the things. Talk about case presentation.
So I did sales while I was in my undergrad. I went and sold pest control for 4 summers in a row. And the first 2 summers I sold in California, which if you've ever knocked doors door to door in California, you know that it's not an easy audience. People don't want to see you. They're not very happy that you interrupted them. They can be kind of mean. And so I got a lot of training on how to present my pitch in a very short period of time, very polished. And I worked on body language. I worked on for that 30-second pitch at their front door. I knew every word I was going to say. I knew where I was going to look. I knew where I was going to point. I knew when I was going to blink. And now I don't think that we need to necessarily do that with our patients, but we do need to kind of understand, like, hey, this is where I'm going to be. This is how I'm going to, interact with the patient. How am I going to mirror their body language? How am I going to, there's just so many different pieces of the sales process. It starts before the patient gets in the office, right? With co-affirmation from your front office when they're scheduling their appointment, and seeing good guru reviews, right? That's all like warming up the patient, getting them ready for Dr. Stanfield, the person they're excited to see. And then when they come into the operatory, they're continuing to receive affirmation from the assistants, right? The assistants are telling them how great Dr. Stanfield is, and he'll be in here in just a minute. And then when I come in, right, making sure you want to mirror their body language. So that will help to build rapport quicker. So if they're pretty sad and quiet and their tooth hurts really bad, I'm not going to come in real loud and happy and, hey, how you doing? I'm going to come in and say, hey, how's it going? I'm Dr. Stanfield. I can see Gabby told me that you're not feeling so well today. I'm very sorry to hear about that, right? Showing some empathy immediately. But there's a whole lot of other things in the course that we go over, just different steps and pieces to build rapport very quickly, so that you can convert all of those patients. I'd say generally in our practice, my goal is every patient leaves with an appointment. Every new patient leaves with an appointment, right? Even if it's as simple as the cleaning, which I think for any practice, it should be pretty simple to at least get them on for the cleaning. But I always present everything that I see. I always present to do it, as much of it as possible in one appointment. And then we present it that way. And when I am presenting it, depending on how they're responding to me and what cues I see and what objections I have, best case scenario, that's what we do, right? We present $10,000 of treatment and they schedule it. We did that yesterday. A patient came in, $10,000 bridge and extractions came in, presented it, and he accepted it. Done. And in other cases, though, you present it, and you can see there's an objection here, there's an objection there, and you kind of have to back down, whatever the treatment plan is, or figure out ways to split up the appointments. Do whatever you have to do to reach the level that they're willing to say yes and go with that, right? And just know that you're going to build rapport with them. They will continue to be your patient. And although we didn't do this other treatment here, we are going to get to that, right? We'll get to that some other time, but we at least need to convert up to where we're able to with every new patient that comes in.
Well, talk about fear. I mean, a lot of the Stoics, a lot of philosophers say that we just live between greed and fear. Those are the two major emotions, and they're good kids. They come out of dental school and they just don't have the heart to tell you that you have 8 cavities and need a root canal and not a simple cleaning. And they're just afraid to tell you everything that's wrong. And I always tell them, like, well, I don't want my doctor to say, well, I don't want to tell Howard he's got prostate cancer, testicle cancer, diabetes, and high blood pressure. So I'm just going to start with the high blood pressure. I mean, how do you coach these kids to start with complete dentistry? I mean, if Dawson taught us anything, it's you do a complete exam and you want complete dentistry. The board's going to demand that. If anything goes south, they're going to get your records. And so how do you get them over the fear of telling someone that they need thousands of dollars of dental work?
Yeah, you should be more fearful of not being honest with the patient and the consequences of that later on. So I always try to tell them exactly what's going on in the moment that I see it, have those hard conversations up front. And I think the patients, they see right through that. They appreciate that you're being honest with them, and that even though that might not be the news they're wanting to hear today, they do trust you because you're telling them something that maybe they're not wanting to hear. But we have patient monitors in every operatory in front of them, so we just take intraoral pictures, get nice clear intraoral pictures, pull up the x-rays. We got little teeth models too. So if there's a lot and they might be surprised, like I'm definitely going to be pulling that stuff up and showing them, like visibly show them, hey, this is your tooth. This is a cavity.
But I'm gonna hold your feet to the fire with specifics. They're going to what's the return on investment? I mean, are you talking about digital X-rays? Are you talking about some of this new AI software that puts little red marks and green marks on the cavities? Are you talking about intro cameras? What technology are you buying that you see works in return on investment for case presentation?
Intraoral cameras and patient monitors to conveniently show them.
And you got a brand on the intraoral camera?
No, I just honestly get some stuff on Amazon.
Is it wireless or is it?
No, you just plug them in. I haven't gotten anything fancy with that.
So intraoral cameras.
I just make sure the tooth's dry and take a nice picture.
You want to know how much I believe in intraoral cameras? I'm back here in Tukey, opened up in '87. The first intraoral camera came out from Patterson. It's called the Fuji Cam. It was $38,000. And I bought it, and everybody was like, they were all waiting for the price to come down. Most of my homies, they waited until it came down to about $10,000. And I'm like, meanwhile, this $38,000 camera is selling a couple of $100,000 a year in dentistry. Yeah. And now it's come all the way down to $2,000 for a handheld wireless. And they still don't buy it, but seeing is believing, isn't it?
Oh yeah, man, that makes all the difference. And so
what about X-rays? Are you digital X-ray?
Yeah. Yeah. So
and any fancy, I know there's a lot of, what is there? Pearl. Yeah. And what's the other one? Pearl.
There's a Dentrix one as well.
Yeah, but
I don't have the
what's the other dental radiography? There's Pearl. And there's another huge one.
It's intraoral camera or
no, diagnostic, X-ray diagnostic. Where diagnostic X-rays.
Cone beam technology is super helpful.
So when you're saying cone beam, CBCT?
Yeah.
Overjet?
Overjet.
Overjet.
So you haven't bought Overjet or Pearl. You don't
Mhm.
need that.
I
Okay.
can use it.
And,
I mean, I'm sure it could be helpful. It's
but you don't need it.
I haven't needed it so
If
far.
you don't need it, you don't need it. I mean, I could usually diagnose with a mirror. I mean, if I look at an occlusal surface as black, I have enough physics now. Okay, so photons of light are flying in at 186,000 miles per second, and they can't come out. I bet there's something down there. I don't need a Ouija board. I don't need to pray on it. I just, interproximal is a bitch. That's that one. But so you don't need any diagnostic software. But you got a CBCT.
I have a cone beam, yeah. So if I'm ever a little unsure about a diagnosis for something, like I'll take that. We'll take those. And
what brand did you get?
Acteon.
Acteon.
Yeah.
And how much did that cost you?
I think it was 55,000, and they gave me a handheld unit with it.
Okay, so
pretty good.
So you think that was a return on investment?
Absolutely, yeah. I mean, the cone beam, the revenue from the cone beam, just the scans that we take is like 30,000 a year by itself, and then just all the extra dentistry that we do because of it, and can do because of it, and we do because we can diagnose more, because we can see.
So that's all you need is the intro camera and a CBCT Acteon for 50,000.
Yeah.
But
then know how to build rapport with the patients and present treatment right.
So have you seen feedback where people have taken your course and achieved these goals?
Yeah, so we have people going through the course right now.
And it's all online?
Yeah. Mm-hmm.
Yeah, so if you're a dentist out there and you got this amazing new dentist out of dental school, you got to mentor this person. But you got to be a conductor. I mean, come on, you take on an associate, you can't. Why are you mentoring them endo? You're not an endodontist, but who you're referring to, you should be able to say, hey, if their schedule falls apart and I got them on a minimum daily allowance of $500 minimum pay deal, and your afternoon falls apart, I want to ship them to my endodontist, and teach them endo, or periodontist, teach them case presentation in perio or implantology. And I'm not going to refer you all my money if you can't help mentor my kid. And so that dentist should, if they go to Elevate Dental Academy, and in 2-3 hours, you think they're going to increase their case presentation? Oh,
absolutely, yeah. And I mean, the biggest thing.
Congratulations on that. That's all the skill set, because the patients win.
Mm-hmm.
I mean, because
they need it.
TikTok's going to get them to. Hell, I can't get on TikTok for 10 minutes without buying
water
my
and
grandkids something. And every time I get on TikTok, did you put them in your car?
Yeah.
But every time I get on TikTok,
this thing.
Yeah, like this, this. Every time I get on TikTok, there'll be some stupid little deal. I'm like, oh my god, my granddaughter Audrey.
I think we just bought this.
And you're one click away, and I'm usually like up 4 gifts at home, so the next 4 times I see them, I already got a gift. But that's the deal. So Free Enterprise is going to get you to buy the big screen. They're going to get you to go to Disneyland. They're going to get all your money. Humans spend all their money. Like 9 out of 10 people live paycheck to paycheck. So it was my mission. Like, if I don't get your money, if I don't get you to accept the treatment, I know you're going to spend the money.
Yeah.
But instead of buying shit from TikTok that your grandkids can be the toy of the day, my grandkids they'll break every toy they've got within anything that flies, helicopter, whatever. That's a 1-hour toy. Okay.
Yeah.
It's a 1-hour toy. And so I look at case presentations like, man, if you can't get their money, then someone else is going to get it. And I think
marketing is not going to be useful to you, right? Like, you get as many patients in the door as you want, but if you can't present treatment and get them on the schedule,
let's talk about marketing, because
you're wasting your money.
Let's talk about the dark side of marketing, and let's all be honest with it. I did this for decades, and if you were referred to me from your friend, you came with trust. And I tell you, you have 3 of them. You come in with 3 fillings. I do all the 3 fillings. If I did a marketing piece and, bring this in for, $50, get a clean exam and x-ray, and then I find 4 cavities, and they're $250 each. And I go, I see how this works. So $100 new cleaning special. Now I need $1,000 of dentistry. And I would say like 1 out of 3 or 2 out of 3, 1 out of 3 usually would buy. But if it's word of mouth referral, they all came in and bought.
Mm-hmm.
So anything I could do to increase the patient experience, the trust, the love, reduce staff turnover, anything I could do for word of mouth referring, they all came in and accepted treatment.
Yeah.
But every time I spent money on marketing abroad, God dang, the minute you told them this, they thought, oh, this is a scam. And their mind goes right to scam mode. Oh,
Well,
I get it.
It's kind of similar with the mergers because you do want to bring like the staff that has the most goodwill with those patients. You want those staff to come to your office because then when Dr. A isn't there anymore and they're all sad, but hey, you know what? Sandra's here and we can still go see Sandra and we can talk to Sandra. And so they are still having, we're kind
Trust.
you're still transferring that goodwill and the rapport through that staff member that you have. And so that's part of how those mergers work the best is definitely.
And that's what kills the DSOs. I mean, everybody's afraid of a DSO. They can't figure out their turnover problem. I mean, I said it for years. I used to say, I wish I was on the intersection of the 4 biggest DSOs in towns because they all come in and say the same thing. Well, I went there Monday and Christian said I needed 3 fillings and I went back and I needed 2. Then I went back for the 3rd one. He's no longer there. Then they brought in Dr. Ryan and then he said that the fillings Christian did were wrong and need to be replaced. And then I had 2 more over here and they're just like, they're just like blowing out of their mind. I mean, I think trust comes down to staff turnover. I mean, they would come in and they always see the same assistant, the same receptionist, the same hygienist year after year after year. They trust, well, I like you. You're a good person. You wouldn't work for a beast, an animal. And so talk about that.
Yeah. The DSOs, I have a little bit of a different insight because one of the practices I got was from one of those large corporations, and I saw.
Oh, you can name names, John. Dentistry Uncensored.
Yeah, right.
You can drop the F-bomb.
Yeah. So it was a Heartland practice, and I was able to just see how they're so much different than a private practice, and while everyone's so afraid of them, and they have good things about them that make them successful, like we have unique things as private practice owners that they can't touch, right? Like they can't, the ability to make a decision quickly and change something about your practice immediately to optimize something, to take advantage of an opportunity. They don't do that, right? They're a DSO. Like it's from top to the bottom. They figure out a plan and they implement it, and it goes through different cities, and they have one plan for practices all over the country, right? Like you said earlier, what the consultant in Hollywood is recommending in Hollywood isn't going to work for the practice here in Glendale. So sometimes the model they have isn't the best, maybe isn't the best way to do it in whatever city that practice is. So I saw that while they had lower supply costs, right? They got their supplies for a little bit less than what I can get my supplies for. They picked the most expensive supplies out there. So if they pick the most expensive supplies and then they get a decent discount on it, and if I'm just smart and look anywhere else for my supplies and don't buy the Kleenex brand and I just look for something that is maybe more generic, I'm going to spend as much as they're spending on supplies. I'll spend less than what they're spending on supplies. It's not hard. The dentist, where the dentist, like the associate, is running the practice, there's so much more waste than a private practice, doctor owner practice, right? Like anything that associate at those big DSOs asks for, I don't know how it works, but I feel like if they ask for something, they can just get it, right? They had so many pieces of equipment that I'm like, what is this? Where did this come from? Why do they have this?
So you bought the practice and enrolled it into your office in Glendale?
So I took all of their So I kept the lease for a little while. And
how long did you have to keep the lease?
2 years. That was probably.
Were you able to sublease it?
No. On regrets of all the mergers, probably the biggest regret piece is having a lease for an empty building. That sucks. Yeah, I wouldn't do that again. There's. I absorbed a big market competitor that was a mile from my practice, and that's an opportunity.
So why was Heartland selling it?
My understanding is Heartland has a doctor owner at their practices, and one of these owners went and bought a second practice, which is a no. You can't. You're supposed to. I think you're supposed to only own one practice when you're a Heartland practice owner. And so he breached the contract. They kicked him out. They put in some associates for a little while. Wasn't really working. So they sold it. And I got it for like 50% of collections. And it was,
And see, that's good. Like you'll notice Starbucks. I mean, everybody's talking about Starbucks, amazing growth. Like, every year they'll open 1,000 new locations. But what people don't talk about is they'll close down 500 others. I mean, when they go into a location and it doesn't work, they give it like 6 months. Definitely no longer than a year.
It's probably 6 months.
Yeah, and in 6 months, and as far as that one location, it's sad. I just watched The Founder again. The movie about McDonald's. God, that was Keaton's best movie, and that's saying something for that guy. And I grew up in that deal, and they left out the only thing they ever talked about when my dad was in the Sonic business. The McDonald's boys, they would not pick a franchisee unless he was married, stay-home wife, kids, went to church on Sunday, because they wanted that community. But they said that's how you own a slave, and you only give him one location. Yeah. So he's not trying to feed his mouth like a single associate.
Chick-fil-A does that, I think.
What's that?
Chick-fil-A does that too.
Yeah. Chick-fil-A, but they do it even a step further. They close down on Sunday.
Yeah.
In fact, that's my favorite joke. Every Sunday, when someone says, "What do you do?" And I say, "I just ate at Chick-fil-A," to see if they can figure out that it's Sunday and Chick-fil-A ain't open. It's an IQ test of mine. And yeah, I mean, Chick-fil-A takes it one step further. They don't even they want someone that's so family oriented that they won't even work on the Sabbath. Yeah. And then you go to like Burger King, and some baller from the NBA will retire and he'll buy 9 locations. He's never worked one. They're all dirty. They're all unorganized. Subway's the king of crap. I mean, there's people, you almost don't even meet a Subway manager that doesn't have 8 locations, and that's why they all suck and they're all mismanaged. So one location is the key, and that's the thing. Also, these young kids, when they're out there getting a job, I think of all the DSOs out there. Well, DSOs have a branding problem because there's 2,800 DSOs. And they're almost all between 4 and 9 locations. And they don't start counting until 4 because the death nail is 3. Because a really young, ambitious dentist says, I could have another location. Okay, go. Now he's just muscling 2 because he's got enough energy for 3. And then by the time he gets to the third one, he realizes he can't be in 3 places at one time. He has no systems. He doesn't do anything. McDonald's, I mean, the McDonald's brothers, they spent, 15 years on that first prototype. Sam Walton worked for his main competitor to Walmart for 20 years before in Helen opened up store 1. Every DSO that makes it, they'll spend 5-10 years on store 1 and get it down. And so then they start the DSO, they start counting 4 to 9. Well, there's like 3 that have 1,000. And when you say DSO, they think of Heartland and Aspen and Pacific Dental Service. And I think Rick Workman's, I mean, he's just a good guy. I love the guy. And all these guys that all bitch about DSOs on Dental Town for 20 years and then build up a $5 million office, when they go to sell, guess who the only big boy is that can fly out in his own jet and write you a check? Yeah, Rick Hartman. So bitch to him all you want.
People scare. I mean, like, before I got out of school, I was terrified that my wife wanted to go back to Phoenix, Arizona, Gilbert, Arizona, and there's tons of dentists, there's tons of DSOs. Like nobody talks positively about that environment. And we consider moving to Tucson because I was like, well, we got to go somewhere that's like small so I can have a chance, right? If we go to some big market and there's tons of DSOs, especially in Arizona, right? So I was just super worried, and I feel like I have been able to figure out how to build a practice in a saturated market, and it's repeatable, and you can do it in any market. It actually works better. Mergers and acquisition works better in saturated markets because there's all these little practices that maybe in the 90s they were booming and roaring and doing millions a year, this last one that I just bought, this was the practice that you remember the yellow pages. There used to be a full page ad for this practice in the yellow pages back in the day. It was the ad with the lion on it. So I don't know if you ever do you remember that practice? So that's the practice I just bought. They did millions of dollars, multi-million-dollar practice. I think they started probably in the 90s, and it's just crazy that now they've gotten to a point where to run a practice, there's a minimum amount of overhead, right? For any practice, right? Like I feel like you can't run a practice doing less than 4 or maybe 500,000 a year because your fixed overhead is just too high. And so these practices that have been around for 30 years, they were doing millions, and now they're doing 200,000, 300,000. They're trying to sell this. They're working through brokers. They're trying to sell this practice to somebody. I don't know who in the world would want to just buy that practice and go into that location that isn't making any money. And even if the books say that they're making money now, the new doctor that goes in there is going to have to update it because the only reason they're making money is because they haven't changed the furniture since 1975. The equipment's from 1990. The computers are from the early 2000s. Like there's just so much left to do there that it's not feasible to buy that practice and just stay in there. So nobody wants these practices, and that's where you come in. You build this profitable flagship practice, and you figure out how many offices are within that 5-mile radius, send out letters to all of them, reach out to all of them, and these ones that nobody cares about because they don't make enough money on their own to be profitable, you can get a great deal on it because no one else wants it. And two of the 3 that I've purchased, all of them I've gotten good deals on, but 2 of the 3, I mean, I'm just spending a few $1,000s. I gave this guy $5,000 for his practice, and I'm gonna pay him $250 a patient for the next 2 years. And every time a patient comes into my office and I convert them and do treatment with them, I'm going to pay him $250. So this is like guaranteed new patients. I only pay them when I'm already making money from these patients. I can't think of a better way to grow a practice in a saturated market guaranteed than this would be.
But how do you think of this? I mean, where do this idea? I mean, you're completely outside the box. I mean,
well, the first one just worked out so well that I was like, I just need to keep doing this. Well, and the other part too is I only work 3 days a week. And I know you worked more when you were a dentist, and so we probably think a little different. But
you learn over the years. I mean, I learned that if the hardest worker, the hardest worker won, then the pigs would own all the farms, right? The donkey would own the farm, and the donkey don't own the farm.
But what I will say is when I have to go in on a 4th day, like I hate it. I hate going in on Thursdays. I will not do it. And so I knew that if I wanted to grow my practice, that the idea of buying a second location, just how you said, the death spot is three practices in your DSO. Like I love my time off. I love my time with my family. I love that I get more than half of my week off to just like spend time with my family, work out, like go do things that I want to do, catch up on things I need to catch up on, work on my business, not just working in my business, right? It's a very important time that I have. And so I wanted to grow my practice without necessarily forcing myself to be in the office 5 days a week. And so if I'm just merging this all into the same practice, what I found is that while my practice is growing and I'm forcing myself to stay in this 3-day time period, I'm just getting more efficient. Like I'm just figuring out how to do this dentistry in this time period. So the more people that I bring in, I don't need more days. Like I'm so set that I will not work. I don't want to be there another day because I enjoy the time that I have. that it's forced me to become more efficient and allowed it me to grow to a really large practice, but also stay with a very simple lifestyle to where, it's not taking my every moment.
I'm going to go back to supplies. Because some people, they buy everything from Patterson or Shine or Benco or whatever. And we know after the pandemic and supply chains that, labor went up because, 20% of hygienists, they were just done. And so, wages went up, inflation went up, supplies went up. How do you buy most of your stuff through one of the big distributors?
Not through the main distributors. I just I know what we need, and I've looked around to figure out where things are cheapest for the certain things that I need. I taught my assistant, hey, these are the websites we go to for this. This is where we go to for
drop
that.
the name. So what websites are you going to?
I know people don't like. I use Net32 quite a bit. I really like Net32.
We had them on the cover last month.
Net32 is awesome.
Yeah,
I'd say 80% of what I get is through Net32.
You say how much?
Probably 80% of the stuff I buy is through Net32.
80% through
most of it.
So
yeah.
explain Net32.
So they.
And by the way, I took a lot of flack for putting it out there because the big boys are big.
Yeah, people don't like. Yeah, people don't like. People don't like Net32.
But anyway,
but I like it. But anyway, there's just a lot of retailers basically that it's like an Amazon for dental supplies. From my understanding, there's lots of different sellers, and so they have all these different products that are put.
So it's more like a portal where.
Yeah, it seems a lot like Amazon, but for.
So when you put an order in Net32, does it all come from Net32?
No, it comes from 6 different Rose Dental in California, and it comes from Pennsylvania Dental Supplies.
And how much cheaper do you think that is than if you would have bought it all from him to Shine?
They tell you the discount on there. I don't know how. I don't even know. I don't know if it's true, but most of the time when they say the discount, it's like half as much. Like it's probably
and that's always a sign that something's wrong in industry, like healthcare. Like you go into the emergency room, they can't tell you how much anything's going to cost. I mean, healthcare is like you go to the grocery store, you get everything you want, but they send the bill to your employer or the government, Medicare, Medicaid, and then everybody wants to know why it's the most expensive system in the world because the consumer, we go for.
Well, my supplies are less too because I'm just not a super picky person. Like I need the supplies that you need to do things the right way, but I'm also like I feel like every associate I've ever met, like they're just so stuck in their ways about like, oh, it has to be this, and then I need this, and if you don't give me that, then I can't do this. Like I'm just, okay, we got the bond has the etch. Okay, great. Let's move on to the next.
So do you know how you can tell if a dentist is neurotic? I mean, like seriously born challenge.
Smacking instruments out of the assistant's hand. I've heard stories.
You ask him, how many burrs do you need to do a crown prep? And if it's somewhere between, after how many burrs do you need? How many burrs do you need?
How many do I really need? I need probably 2.
Yeah. And at 5, it's like, what? Excuse me. There's dentists that have 15 to 20 burrs on a burr block and go through each one of those. And I lived through Omar Reed, and you go 100 miles away from home. He's a legend. You go in his backyard, all these people are throwing rocks at him. They never even listened to what he said. They did the same thing to Scott Perkins. Omar Reed said that when you prep a tooth for a crown, the burr is only touching the tooth for 90 seconds. 90 seconds. He goes, but that's not what they do. They drill, rinse, dry, look, change the burr, drill, rinse, dry, look, change the burr. He goes, if you just go in there and cut out the interproximals and do your, he goes, you're only drilling on that tooth for 90 seconds. He goes, if I drilled on a tooth for 5 minutes, there'd be no tooth left. I could drill it out of its socket. And Scott Perkins said the same thing about endo. He did the 15-minute root canal. And I mean, I had more hateful, vile letters from endodontists. I got banned. An endodontist in some province in Canada was in the chop chair guy, got me banned from ever lecturing there. And it's like, whatever. I mean, I've lectured in 50 countries. I don't need to go to your but it's funny how people, they don't even listen to what Scott Perkins did. He had 4 endo files up. So when he was doing the 8th file, and the assistant was loading, the 10 and the 15, and what his moments that he did in 15 minutes is what your endodontist to do in 90 minutes. He just thought through the entire process. Everything was set up. There was no downtime. Mm-hmm. And then you go to the endodontist, you watch them doing, and they're like sitting there after they're done, and they're like, unclip the file. They're making eye contact with me. They're putting off, and they're trying to thread in another one while they're still talking to me. And that dumbass I know from 20 years ago was badmouth Scott Perkins. Like, really, 20 years later, you still didn't learn anything. All you could do is judge Scott Perkins, rest in peace. Love that guy. And Scott Perkins, I mean, he just mastered logistics. So yeah, I think I think that, yeah, if you need more than 5 burrs for something, you need therapy.
Yeah.
I mean, what the hell are you doing that you need 5 burrs for? Totally. And then with infection control and sterilization, I don't know if I want my burrs autoclaved. I mean, I'd hate to get, even though, when you get a colonoscopy, they didn't buy a brand new camera for your asshole. You know what I mean?
Sure.
It was basically cold steriled, and you're thinking about that. And I remember asking, I said, how far is that going? And he goes, about 3 foot. And I'm like, oh, nice. 3 foot. I said, did he ultrasonic vibrate it before he did? He goes, how is all clean. But so we talked about supplies. What about lab bills? What about lab?
I think associates. I'm kind of picking on associates because I've just seen them just be so picky with things. But you need to be open to looking at different labs and finding one that doesn't just totally kill you on price, but does good work, right? Like you have to have good work, right? Like that's important. You can't build a practice. You can't do dentistry for people unless the crowns fit well and they look great. So when I first bought this office, the lab that they were using was about 40% higher than the lab I was using the year before as an associate, and the work wasn't as good, right? So it was an easy decision for me. I was able to switch to the lab that I found now, where I'm getting layered zirconia crowns for $65, and they're beautiful. Like they look.
And what's the name of that lab?
Always Dental.
Where's that at?
Apache Junction.
Always Dental.
Always Dental. Yep. Terry Nelson.
Always Dental, Apache Junction.
Yep. So he.
I approve of Apache Junction. You got 2 grandkids out there.
Yeah. So he does a great job, but I think people are like, oh, well, I only do my aesthetic work here, or I only do this here, and I'll never do something. I'm like, well, maybe just send one, like, see how it looks, see how it fits. You got to be willing to like.
Okay, and to put that in perspective, what's he charging as opposed if you went to Glidewell? Is it similar, same, 20% more, 40% more? What?
I think like how much are layered zirconia? So
how much is always local in Apache Junction?
Yeah, so if you went to, I will say I send most of my business to him, right? So and I've been with him for a while, so my price is probably a little bit different than what you would get if you just went to him straight away. But it's still even here's your price right now, first person, first day. It's still going to be a lot less. I'd say most of the labs are $130 for a layered zirconia crown, and his prices are going to be probably $90 somewhere around there. I'm not sure where he's at right now compared to what those other labs are, but like the work is great. The cost is significantly less. So you just need to find a lab that's going to be able to accomplish those things, and you can't find them if you're not willing to send some work to somebody and figure that out.
Okay, we've spent a lot of time on Elevate Dental Academy. It sounds like you definitely, if you're listening to this, you definitely want to take that course. If you're when we survey associates, what do you like the least about your current situation where you work as an employee? They always say it's because the doctor's not mentoring them. And I'm telling you, you can't mentor them in everything. You can't mentor them in endo, perio, ortho. I mean, you got to be the conductor. And this would be a good way to mentor them. Just buy the course for them, set them down. And if you're doing a minimum guarantee daily, a lot of people are doing minimum guarantees. I never did, but it seems to be the all rage now. Well, then just next time they got a down deal, tell them to go to Elevate Dental Academy. and learn from this fine man. So let's go to the other one, Elevate Dental Consulting. What's the difference in that website?
So that's one-on-one coaching. So
With you.
Yeah, one-on-one.
And how's that work?
So there's a monthly cost, and then basically we'll have a coaching call once a month. We'll have a sheet they fill out before, go through extensively, just different areas of the practice and questions that they have. And then throughout the rest of the month, they'll have access to, email me, text me questions and problems and things like that. The biggest thing with coaching is you need to find somebody who's doing what you want to do, right? Like that's the best, that's the most surefire way to accomplish your goals. If you have a specific goal, go find somebody who's done that specific goal and get them to mentor you or pay them to coach you. Like that's it. If they've already done it, then they know how to do it. So get their help for that. And so I like that I've been able to build a practice in a saturated market. I think there's a lot of people that want to maybe, they don't want to live in some rural area to make the money that they want to make. They still want to go live in Santa Barbara or, wherever it is that is a fun place to live, Denver, Colorado. But they don't want to, they're afraid of being successful with how many other practices there are. I feel very confident that I can coach clients to be successful.
Okay, well, tell me this: who's your ideal client? I mean, you've done a lot of clients, and by the way, this guy is he's in my backyard. I mean, this guy's the real deal. He should come with all the trust you need. But who's your ideal client? Because obviously there's dentists. I mean, it's like DSOs. Yeah. I mean, I talked to Rick about this the other day. I mean, there's people that should never ever work in a DSO. I mean, you got that owner operator spirit, and you're a loose Mustang cowboy. There's just personality sets that. And I even told a lot of dentists, they complained about who they work for, and I was telling them, I said, no, there's no problem with the dentist you work for. It's the fact that you act like you're a big boy, but you live in fear because you have an owner-operator mindset. And, I graduated May 11th. My office opened September 21st. And here you've been bitching about 3 different guys you worked for the last 3 years. And you're acting all bravado because that's who you really are. But inside you're living in fear. It's like when I meet someone and tells me, well, she's my baby mom. I said, well, what is a baby mom? That's one of my kids. I said, so you date your baby mama? I said, how much fear? I saw him. How much fear do you live in that you can't even commit to the woman that made your baby?
Yeah.
My God. I mean, have you thought about a therapist? I mean, what are you afraid of? I mean, you're living in fear. You're still looking around. It's not your wife, dude. You're living in fear. And these associates, the louder they bitch and the longer they bitch, the deeper they're living in fear. So is that your client? Is it older people? Who is the dentist listening to you right now that you would serve best?
Honestly, I want someone that's just getting into practice ownership. Someone that's bought a practice.
Young,
yeah,
right?
Someone that's young that just got a practice. That,
what if they're still working at DSO?
My coaching can help. I can help coach you on efficiency in clinical dentistry and things that.
I mean, coaching them over their fear to pull the plug. I mean, it's like they want to walk around a swimming pool for 10 years. I was lucky. I had 2 older sisters. They just pushed me in the pool. Yeah.
I think if you don't
drown or learn how to swim.
If you're still like, I'm not even thinking about this. I mean, obviously that's not going to work. But if they're wanting to make the jump, they want to have someone there to analyze practice. I love looking at.
Well, when did you graduate and when did you start your own?
So I worked for a year. I actually worked at a DSO. I worked at Risa's Dental, and I loved it. Actually, I loved Risa's Dental. They're awesome. I saw one of the guys at the turkey trot thing in Gilbert the other day. Said hi to him.
He's an amazing man.
Yeah. So they it was an awesome experience, and I
got one of his orthodontists working for me on Orthotown. Yeah. Julia Estrada.
So I worked 3 days a week. I made over $400,000 in my first year out of school. Nobody called me when I was out of the office because there were 2 other doctors there handling everything for me. Because that's how they do it. They stuff they do the same thing that I'm working to do right now, right? They stuff an orthodontist and a bunch of general dentists into one place and build this super practice and drive down their overhead and, have crazy profit. So the reason I left is I honestly, I did really love it, but I knew that I went into dentistry to buy a business, own a practice. Like, that's the whole reason I did this. And I knew if I didn't make a decision soon, if I didn't make the jump, that I would get comfortable. And I was afraid of staying there forever. Like, I need progress. I need to be able to keep growing and improving my business and improving my profitability. And just, I needed to be able to do that. And so I forced myself out of a really good situation because I wanted to grow. And man, this first 6 months of owning my practice, and probably the first 6 months of any practice owner's experience, it was tough. Like, I definitely thought not, a bunch of times about, did I make the right decision? Because this sucks. This is so hard. And you have to work at it constantly, and it takes time. And I'm still on a monthly basis finding things within my practice to optimize and change and make better, and it never ends. And what you'll notice is just the more that you continuously optimize and improve, it's just this slow roll, and you wake up one day and you have the practice that you want, right? Like, you don't just, in some cases you get it really fast. Sometimes you buy it like that. What I bought looked really good on paper, and I thought I was excited. And, when I get in there, I see why it looks so good on paper. The doctor was doing his own bookkeeping. When the doctor's doing their own bookkeeping, that, there's all sorts of problems in the practice. The equipment, everything broke. Like, literally 1 month after the next, there was a new thing that broke that I had to replace.
Dude, you do that, your family picture. You only show 3 babies on your family picture on your website.
Oh, yeah. We got a 7-month-old.
Oh, my gosh. I hope that boy or girl.
Boy.
Well, I hope he doesn't know that right now, it's after half a year on Earth, his daddy doesn't even have his picture on his website. Yeah. My God, I hope he never finds this podcast down when he's going to say, Dad, I didn't make the picture in the world. But I just want to say something to my homies out there that, what Christian's doing, he's being true to himself. He was an entrepreneur. He knew when he came out of dental school, he needed some skill set. I mean, if you come out of school, you've only done 15 canals of endo and 50 fillings, you need some time. Going to a DSO, I mean, I can't believe people work at Heartland Dental and they never, I'd say, what's it like working for a man that owns 1,000 offices and is a billionaire? Like, all bitch and moan. It's like, dude, your dad owns his own dental office. Your dad can't manage his own dental office. Rick's working 1,000 and you didn't, I mean, you're working for Picasso and you're not taking notes. Yeah. I mean, my God, you're not up there. How does he do it? And then you walk up there and I'll say like what's the code for a dental sealant? Oh, I don't know. Have you ever checked out a patient? No. What do you do in between patients? He sits back there and moats about, just negative everything. Yeah. And then there's other ones that they go work for Rick Workman and they memorize every procedure, everything he's doing, everything. In fact, when they leave to go start one, he'll take their best employee with them and then they'll go start one. And life is an attitude. And then there's other people that are working at DSO. I mean, I know lots of people that work for DSO. They never, what you're doing in your life, that's their biggest fear. They wouldn't want to do that if you put a gun to your head. And there's nothing wrong with that. It's being true to yourself. I know a friend girl, Dennis Merriam, and she came out and she had a kid. She found herself a single mother. Well, that was her main project, and she didn't want any other projects. She's been happy as a lark at Pacific Dental Services for 2 decades. Mm-hmm. And I always tell people, if you're at a DSO and you love it, well, don't let any haters there. And also these haters, they do all this, and then they find themselves one day where, they got a dental office, and the only factory in their town closes down, and then maybe they go through a divorce or a disease, and the next thing they know, they need to be an employee, and now they're thinking their lucky stars are working for a DSO. Yeah, and it's like, dude, so stop with the hating and start focus on being true to yourself. And I've seen people, you change throughout life. you're one divorce away from maybe wanting to work for DSO. But when you pick a DSO, the first question you might be asking yourself is, the first question I do when you go meet a DSO, ask every single person in that office, introduce yourself, what is your name? Then ask them how long they've been there. And if you meet an office manager that's running more than one location, run. And if you sit there and you meet the assistant, hey, I've been here 2 years, and you meet the hygienist, she's been here 1 year, and you meet the no one in your office has been here 2 years, but the office is 10 years old. And something's incredibly wrong. Go find a Chick-fil-A. Go find a Chick-fil-A. Why? The dentist only works here. The staff only works here. We all only work here. We all give up what we got. And as far as the church thing, all that means is that, well, if you really want to be open 7 days a week, something's wrong with you. You don't have a life. And Chick-fil-A says not only do we shut down the Sabbath because they're Christian, it could be golf, it could be astronomy, it could be whatever, but it could just be kids. Yeah, if you don't need a day off, there's something wrong with your head. And it's funny that the Chick-fil-A that actually closes down for that day, they do 5 million a store, but the McDonald's are open 7 days a week. They only do 3 million a store.
Blessings.
Yeah, blessings. And it is blessings. And I wish they would have covered that in the founder better, because Sonic Drive-In, when my dad was doing it, they were predators. They called them slaves, because they said, man, you get some single guy that wants to open up a chain of Sonic Drive-Ins and everything. He's all in it about himself. He says, but he's all in it. He's got one mouth to feed. You find someone with a stay-home out, like your wife, be perfect. She's got 4 babies. That's 5 mouths to feed. Yep. And you get someone that needs to feed 5 mouths, and they're only working in one location. Guess what? They get there early. They work through lunch. They stay late. We used to pray for Mormons when I ran my prayer, Mormon associates. I mean, the single guys, they would be up there trying to get the receptionist to reschedule their 3 o'clock, their 4 o'clock, because they want to hit the gym before they hit the bar. They want to get their pump before they hit the happy hour. The Mormon kid, you'd sit there and say, we got a toothache. Is there any way you squeeze through lunch? Hell yeah. I mean, I remember one time we closed at 6, and the receptionist went back there, and he just had like a stay-home wife, and I think just like 2 kids at the time. And he says that, well, we close in 15 minutes. And he said he can't get here for 30 minutes, but he's got a screaming toothache, and he knows he needs a root canal built in the ground. And the Mormon says, hell yeah. Yeah. I mean, he thought it was a manna falling from heaven. So, so just be true to yourself. If you don't ever want to get married and have kids, you don't want to live that life, go do it. If you want to work for DSO, go do it. But if you are true to yourself, and you seriously want to elevate your dental practice, and you want to elevate your dental career, I can vouch for this guy. I can't believe we went over our hour. And you got to. So my final question is, how did my homies contact you?
You guys can reach out through Elevate Dental Coaching on Instagram. The website is actually elevateyourdental.com. I think that might have.
Elevateyourdental.com.
Elevateyourdental.com.
And what's it called on Instagram?
At Elevate Dental Coaching.
At Elevate Dental Coaching. Yep. And then you got the Elevate. And what's the website for Elevate Dental Academy?
Let's see here. Well, it's through Teachable. So yeah, it's the Profitable Dentist Academy, Elevate Dental Academy on Teachable.
Okay. Well, man, it's been an honor. It's been fun. And you got 4 lucky kids there. Yeah. I know you're into that big time, and that's all that matters. So thanks for coming on down, and have a rocking great day.
Thank you, Howard.